meeting. We'll have our full regular meeting in a couple weeks. And the purpose of the meeting is twofold. One is to hear the plans for the reopening of the senior center and welcome Kevin to talk to us about it. I know that there's been discussions with Christine, Schwang, Peter, Kevin about, best practices and protocols to do that. But that whole issue that actually Kerry brought up last time opened up a broader issue we kind of realized early last year. And really, we have to come to some decision about, how to approach that now that, things are changing. I noticed today on the mass.gov website that Reading is now in the gray, which is even lower risk than the green, which is great. And Christine had passed on information that currently we have 3 active cases. So things are pretty quiet right now, which is
wonderful.
Great.
That's wonderful news.
So without further ado, I don't know, Peter or Kevin, do you want to kind of launch into it? I don't see any members of the public here, so I don't think there's any public comment.
Yeah, Kevin, why don't you just hop right in? You're part of the team.
If I could share my screen again, thank you for the opportunity to share what we've come up with to welcome our seniors back to the center, which they have missed dearly. Okay, can everyone see that?
Yep.
Okay.
Yep.
Again, we did send out a newsletter on this past Monday announcing the opening with the hope that you would allow us to continue. It's been a brutal 15 months for all of us. It's been particularly brutal for our seniors, just the social isolation for them. When we started making phone calls last March, they were 5-minute wellness calls. Hey, how you doing? They were doing okay. As we get 6, 7, 8, 9 months into it, they were 45-minute calls because they needed somebody to talk to.
Yeah.
So it's really just time to welcome them back to a safe center. Protocols, we're basing them on, again, consultation with Peter, Christine, and Schwang. As well as Mass Council on Aging. However, the Mass Council on Aging has typically deferred to local boards of health. That's what they've done all along. So again, what we've come up with is based on that consultation, also working with other Council on Aging directors. How are they interpreting the rules? What are their boards of health allowing them to do? And unfortunately, every senior center is different. Mass Council on Aging says if you've seen one senior center, you've seen one senior center, because they're all different.
Boards of health.
I was going to say, they stole my line. No.
I mean, I don't know if we're the only ones working with an old fire station, but our center is unique. But I think we do a fantastic job making the most of it. So again, what will we be doing when we open? We plan on being conservative. We plan on opening slow. A morning activity and an afternoon activity. Only on the first floor great room, which does have wide doors, French doors, which we can open up to the patio to let some fresh air in. The second floor will only be used for individual counseling. Shine is insurance counseling. So that'll be a one-on-one upstairs, again, with rooms that we can open windows, and one-on-one computer assistance. There is a bathroom upstairs, but right now we're going to limit the patrons to use the bathrooms down in the basement, just to have one less thing to have to clean upstairs. We will have signage available. The mask PPE will be available. There's been additional sanitation dispensers installed over there. We are going to, again, we can't mandate that people wear a mask, but the staff is planning on wearing masks. And again, advise and encourage people to wear a mask. And they'll be required for people that are not vaccinated. Vaccination is based on the honor system. Obviously, we can't ask. So hopefully people will be honest and take care of each other. We will have signage. And we're going to focus on passive activities, again, in the great room. Chair yoga, Tai Chi, strength and balance, art classes. Art class, we sent the pleasantries out on Monday and the art class is almost full. That's almost always one of the most popular. Best is also very popular. Bingo, we're looking forward to that. All tables and touch surfaces will be wiped down after each program. Facilities will be helping us out as we break down different tables and set up for different activities. And also a tent will be installed on the patio. 16 by 24 tent is going up next Wednesday, which we'll plan to use for outdoor activities, programming. If we get to some type of lunch or dining options, we'll be able to do it out there. It'll just give us options. What we will not be doing, congregate lunches. Again, they've never been great, to be honest. Mystic Valley Elder Services provides the lunches. And I think we'll need to get more creative to bring people in, work with local restaurants and provide something a little more appetizing than what people were used to. So we look forward to doing that down the road, but not right now. The billiards and computer rooms are down in the basement. There are no windows. They're very, very close. So we're going to hold off on doing anything down there. Any of the cards, different games where there are touch surfaces, people may be sharing things. We're going to hold off on those as well. The hairdresser, the line dancing, the Reiki and reflexology, and the Zumba. The Zumba, again, because people are going to be huffing and puffing, but also because that takes up so much space. It just doesn't allow, so we can use the upstairs rooms confidently. We want to save the great room for as many activities as possible. And again, we're excited to have, hopefully, our new Elder and Human Services Administrator is starting on Monday, June 7th, after we were in the hiring process March of 2020, and we all know what happened after that.
Thanks. Well, congratulations on that. Makes me nervous that it took you 16 months.
Well, again, we didn't know what to expect. The center wasn't operating. We didn't expect. We don't know what to expect next week when we hopefully open.
Okay.
Again, our goal is to provide a comfortable and safe environment and welcome people back. We don't know how many people will be hesitant. When some people have called up to make appointments, they have specifically asked, what rooms are you going to do it in? I think some people for art were happy when we said we're doing the art down in the great room rather than upstairs in the art room, which was very confined in the past. So again, they're showing some concern, but again, everybody they're so anxious to come back. And again, as demand and comfort levels, as we learn through the month of June, we will be expanding programming on a case-by-case basis. And I anticipate working with Peter on that and saying, hey, we'd like to do this and get his thoughts on the safest way to go about it. So again, we're going at this slow, conservative, and we want to keep everybody safe. So again, thank you for your time and open for questions.
Before we open for questions, can I just pop back to that last bullet, Kevin, where you said you were going to ask me for some advice on that stuff? I'm happy to give advice, but only after I talk to our experts, and that would be Christine and Schwang, and maybe that's maybe a good segue into your presentation for them to add their information. Christine, would you mind telling us what the counts are today regarding all this stuff, and just assuring us all that, you know, you are monitoring health status of the community every day through Maven and in other ways through your networks. So I'll turn it over to Christine for a few moments here.
Yes. Good evening, and thank you, Kevin. That was really great to hear, and I am very grateful to be a part of the reopening plan, any recommendations, and I do feel that it is important to instill the confidence in the residents coming back, as well as the staff. And I think the approach that has been recommended is the correct one. And I know that although temporarily, this is a temporary thing, I feel that it is appreciated. And I can just simply state that I've received a couple of calls from seniors as well. And they have commented that they are happy that the center is going to be open, and that we're taking some at least initial extra steps to ensure the safety of the residents and staff members. But it is really good news to report that there have been only 3 new cases over the past week. The count has, they've been coming down, and as Dr. Lopez had stated, we are in the gray. Our total case count is 1,915. Deaths reported 49, and that's been a pretty, that has not gone up, I would say, in at least 6 months. Transferred cases out of state has remained the same at 10, and the amount recovered is 1,853. Also important to note is that there have been no hospitalizations reported over the past 3 months. Yep. At the moment, there are no clusters in the community, business, or school.
Thanks, Christine. And this might be distracting, but I wonder if, you know, this came up last week when the fire department called me and said they no longer have interest in receiving the weekly numbers reported directly to them. And Christine and I began to think about, you know, do we really need to put this up on the website on a weekly basis? And, you know, that's been part of her role all along. And then she shared it with Schwang in recent weeks as working with the website. But I'd like to hear from the board members while we're on this section of it. Do we want to continue reporting numbers of cases? I mean, maybe wean away from that, like every 2 weeks to every month. If it starts to tick up, we can start to put it back on there. But I think there's other things we need to have folks focusing on other than COVID for these months coming up. What's anybody else think, please?
My thought is that with the, perhaps we could consider anyway, that with the governor's rescinding the emergency, that we could either just not report at all or go to monthly.
Mm-hmm.
I didn't discuss this with Dr. Lopez, but really it's your place, Rick, to carry
Yeah.
this conversation.
Well, you know, it's a good point. You know, I think that, you know, what we might, I sort of favor a little bit on the weaning side. We've actually already gone 2 weeks because the last posting was May 20th.
Correct.
And so we could do, you know, 2 weeks for every 2 weeks in June. And if the numbers stay in single digits, and things stay on track, which, given that we're going into the summer, we have every optimistic thought that this is what's going to happen, then maybe starting in July, we would just do once a month, as Paula mentioned. Because I think, you can navigate the mass.gov site and try to find Reading in that map and so forth if you're so inclined.
It's out there.
But it's a convenience, I think, for the residents to, at least at that point, once a month, to kind of know that what the numbers are running. Just because we're reporting to our website doesn't mean we aren't looking at the mass.gov website every week and kind of tracking things. And as Paula said, if things start to pick up, then I think we would want to start reporting more frequently. But I would be okay with every 2 weeks in June and then monthly afterwards, unless there's a change. Anybody else have thoughts on this? Or
Yeah, I think that I like that strategy of a gradual decline. And I think it would be good to add a statement to the website that, COVID is one of the reportable diseases that the Board of Health continues to track and report, that there's active involvement, and that people can always inquire or search the website. I just think adding some language, explaining our decision, explaining that just because the numbers don't appear doesn't mean that we've stopped paying attention.
That's huge.
Yeah, because I think that, yes, the numbers are out there on the mass.gov site, and I know there are a lot of folks who go out and look at those. And I don't know what the web traffic is, but I think we want to, as you said, Rick, we want people come to us for some information, and we want to respect that and just sort of acknowledge it and say, yes, we continue to, the department continues to do this work. And, if circumstances change, the reporting will become, posted again. But
sure.
Yeah.
Okay.
Could I pick on Kevin for a second, Mr. Chairman, because he's a numbers guy. He's contacted me, when we were, late, and he wondered today, why wasn't it up last week? And how do you feel about it, Kevin?
I think Rick's approach would be just fine. I think it's I wouldn't want to go cold turkey, because we've had in the past issues with communicating to the public in general, and they've been, when we were in the midst of it, they were dying for information to come out of the Board of Health, and we did a much better job. We changed that course and did a better job. So I wouldn't want to get away with it altogether, but a slow downgrade, and that people can kind of get used to seeing, and maybe even a blurb up there that our reporting will be less frequent as the need goes, and vice versa. Something to that effect, to Kerry's point about having a little blurb that, so people understand moving forward. If you don't see new numbers, it's a good sign.
Yeah.
Perfect.
Okay.
And Mr. Chairman, excuse me, though this has something to do with the opening of, I got a little bit off track. It's not unusual either, by the way, but this does have something to do with the opening of the senior center. We wanted to make sure the board understood we were tracking, and even though we're not going to be recording, I can guarantee Christine is monitoring Maven and her network routinely to make sure the numbers are accurate. So if we can proceed, I would say next we should hear from Shuang for just a few moments, because she has some ideas of programming tandem with the opening of the senior center that might make, life a little easier for those folks who haven't been vaccinated and don't want to wear masks. Shuang, are you ready?
Yes, I'm ready. Yeah, I do have 2 slides to share with you. Okay. So just some updates about our COVID-19 vaccine. And next. Okay, so some quick updates regarding the homebound vaccination. So according to Mass Department of Public Health starting from June 1st, all future homebound vaccination requests will go to the state COVID-19 homebound vaccination program. And here is the screenshot from our website. So now our residents can call the state central intake line at this number, and they work from Monday to Friday, 9 a.m. to 5 p.m. They also offer different languages. So if any residents need homebound vaccination, they can call the state program from this number. And the other thing is we have some remaining doses of JJ vaccine. You know, in April, we ordered about 70 doses JJ vaccine for our homebound vaccination. And because of the blood clotting issue, we wait for a couple of weeks, and some candidates decide to get other types of COVID vaccine. So we total used 28 doses for homebound individuals. So after all the homebound vaccination ready, we have 40 doses of JJ vaccine remaining, and they will expire on June 23rd. Our initial plan was to return all the vaccines back to the state lab, and they were agreed with that in the beginning, but after a weekend, DPH said they are not taking back any vaccine, and they asked us to hold on to the remaining doses and find someone who need it. So here is our draft plan for the remaining doses. We plan to have walk-in clinics on June 16 to 22 in the morning at Pleasant Street Senior Center. And, you know, since Senior Center is opening on June 15. And we plan to post the announcement on town website next week. And we also plan to inform the local pharmacy, CVS and Walgreens, because CVS is giving Moderna vaccine and Walgreens is giving Pfizer vaccine. So, and a CVS technician told me that they do have some customers asking for JJ vaccine. So, so providing the access to JJ vaccine may be an option for our working clinics. I think that's it.
That last slide, excuse me, Schwung, but that last slide was important. The last bullet on the last slide, for that matter, and it was, you know, just a few months ago we were talking about how to engage CVS or Walgreens to do this. This came up inadvertently, but Schwung had her eyes on the ball. That is, and there is a CVS or Walgreens, I'm not certain, directly across the street from the senior center. So the point is, if someone at that walks into Walgreens and wants the one and done that I took, that was easy and I loved it, they can walk across the street and help use ours up. You heard me say months ago that we wanted to, there's your cat, Jackie, that we want to vaccinate anything that moves rather than see it expire. And I think Schwung used a little bit of innovation and including that element what was described on the bullet. I didn't want to overlook that. But this all, again, has to do with Kevin's reopening plan. We're trying to enhance it by keeping a track of the numbers and by offering vaccines and alternatives from the vaccines that we have by collaborating with across the street Walgreens as we go along. So I think we have a good comprehensive plan in place. And now, Kevin, you can give the question on the table. Was anybody have any questions?
I don't have a question, but I would say that the plan that Kevin presented sounds great. You know, it sounds like you've really thought through with the health division staff the best way to do this. I also think that I mean, it's great to have those walk-in clinics in addition, because that's just like icing on the cake. The other point I would make would be that I remember, I don't know, maybe it was 3 or 4 weeks ago, I gave an update at the select board about the percent of Reading residents who had been vaccinated. And the numbers, certainly for over 65, were quite high. They were in the 80 to 90% range, and that was a month ago. So I'm presuming that what we're seeing is we're a town that now has 3 active cases. The vast majority of our elderly population is vaccinated, and we have a very safe opening plan for the senior center. And so I think that all that coming together makes me feel very comfortable about moving forward.
Yeah, I just shared the data from MassGov on May 27.
Yep.
So
Okay.
in the green, they are our Reading population in different age groups, and in blue, they are the fully vaccinated individuals. So yeah, like you said, the elderly population has been like above 90% of them have been fully vaccinated. So yeah, just want to share this picture. Thank you.
Thank you. That's great.
That was great. Thank you, Shwung.
I could just add one thing. We did a survey way back, oh boy, I think in the fall, and asked people when they would be comfortable returning to the center. And I think the biggest response was once there's a vaccine out there. So
I had a question for, I don't know, Peter.
again, they'll feel comfortable to come back.
Jerry?
Yeah, I just had a question. When you post that you're having the walk-in clinic, are you going to specifically say it's the J&J vaccine? Just so
Yes.
no. Okay. I think that was really interesting that you know which pharmacy is giving which vaccine, because I don't think we ever thought that there would actually be a choice in which ones we would, but it seems we're at that point where there may be a choice. That might be, Reading residents that are not vaccinated might want to know that. I don't know if we can put that on the website or not, though.
Yeah. Yes, I talked with Peter about that. I'm going to say we have 40 doses of JJ vaccine, and we will have walking clinics on certain days and like what time, and then people are welcome to our clinics.
Is there a way that you can communicate that through whatever means the senior center communicates to its participants? In addition to the town website, is there a particular website that Kevin you use or a way of communicating?
Our program coordinator does have an extensive mailing list, so she can send out a broadcast to our clients, and we can also put something on the web or the Pleasant Street Center webpage.
That would be good. That would be great.
I just have a question. Is this going to be open to just seniors or all the public?
I know Kevin preferred for the senior population. I'm just having a concern because, like the data said, 90% above senior population have been vaccinated. I just concerned if we can find 40 people from senior population. If that's the case, then we can go ahead to do that. But if we could not have 40 people, then we may think about other options.
Okay.
But did you get that, Kevin? The most important thing right now is to get rid of the vaccine before it expires.
Oh, I agree.
We would prefer to give
I'd
it
hate
to our
waste it.
seniors.
Yeah.
Yep.
Yeah. And Kevin, oh, go ahead.
I was just going to ask through the chair if I could address Jerry's comment was a good one, but you missed out on the culture that evolved along the way, Jerry. There were people shopping for the different type of vaccine, and they would call, and if they didn't have what they wanted, they'd hang up and try another number. And so, yeah, that turned into the later days of the vaccine clinics around here. So sorry you missed that. I don't know what you got for your vaccine, but
I got mine very early.
all right, so you just wanted to get it, but towards the end, people were getting fussy. I cut somebody off when I began that, so sorry.
Yeah, I just wondering, Kevin, about the time. So we can have like from 16 to 22 or in the morning, because from your newsletter, I saw most of your activities are in the morning. If you want to have a specific time and date, just let me know.
Okay, I think we can take that offline and work out a flyer or the advertising on it.
Okay.
So in terms of, I know that this original agenda item was in terms of formally voting to open the senior center, but because our second agenda item really encompasses that and more broadly, I'd like to defer a specific vote on the senior center for a few minutes, because I think the next discussion is going to be a much broader discussion. And will encompass opening the senior center as well. So if we can move on to agenda item 2, and maybe Jackie, can you put up the resolution that the town council had drafted based on our earlier drafts? If you can put that up on the screen, just so people know what we're.
2 seconds to log in on the work computer, because that's on my personal computer.
Okay. Well,
So
that'll give me 2 seconds to give a little bit of preview here. So after, might have even been after the last meeting, I don't think it was during, we realized that, gee, it's not only a vote about opening the senior center. The Board of Health had closed many other facilities, had made other types of motions and orders, particularly in the early part of last spring, relating to the pandemic. And at this point, and many of those in the pre-board packet that Peter had distributed, you could see all the motions that were made. And many of them did not have an expiration date. And so they're sort of out there as theoretically active Board of Health orders. And so given that the Board of Health, given that the state of emergency expires June 15th, and given that actually the town of Reading state of emergency, as voted on by the select board, also expires coterminous with the state. So, you know, we talked about, Peter and I, Jean had talked about, well, should we go through all the motions that were made? And okay, do we have can you make this a clean copy? Yeah. Should we go through all the specific motions that were made and sort of rescind them, which would include closing the senior center, amongst others? Or could we do a broad brush order that says basically what this proposed resolution says, which is that, you know, the COVID-19 related orders going back to March 11th, you know, we're rescinding and taking their place, we endorse, and, you know, to the extent allowable, we're going to follow the Commonwealth's guidelines, advisories, and mandates, which in turn, the Commonwealth generally follows the CDC guidelines, mandates, and advisories. So this seemed like an all-in-one solution to cleaning up any past resolutions that the Board of Health made, as opposed to trying to go through and parse them and having separate motions on all of them. And so what I'd like to propose is that we, you know, have a motion and vote on this particular resolution. But before we do that, maybe maybe we can have some discussion if people have comments or other things they would like to say. And if Jackie, if you can unshare for a minute so I can see people for the discussion. Yeah, thanks. Any thoughts about this? I think everybody has seen this in advance, so.
You said exactly
Sure.
what I was wondering, if we could do that after seeing that from, was it Alexandra, the from
Yes, the,
town council?
yeah.
Yeah,
yeah, we actually asked her, can we do this? Can we do
Yeah.
a single resolution to rescind, not go through individual ones? She apparently thought A, yes, and B, she, in her loyally way, revised our earlier draft, but it says the same thing. Carrie?
all for
Yeah,
that.
oh, sorry, Paul.
Nope, finished.
Yeah, I just want to say, a thank you to Peter and the rest of you all for the methodical and practical way that you went about identifying what the motions were and how the progress had been made. It was a lot of work, but it was exactly the right way to approach this. And working with town council to identify what the most expedient way to have the board vote and address the votes that they had taken over the past year, 15 months, is excellent. So I thank you, Peter, for your leadership on pulling us through this. And I'm sure you really enjoyed the whirlwind tour. I think we talked about this. I'm sort of getting to see everything that our predecessors had taken on. And I guess while I'm talking, I just want to take a moment and acknowledge again, and I don't know if there'll ever be enough acknowledgement, what the board took on starting in March. It just, so it was, I think Emmy Dove was the chair, Eleanor Shonkoff was also on, as was Kevin. And I know there were 2 associate members whose names I don't recall, but this board just, the work that they took on, not knowing that they just brought the dedication and were meeting nightly and just continued on and sort of went at it with a problem-solving attitude. And I'm again impressed getting to look through all of those votes, all of that discussion, at how thoughtful and careful your attention to this was. I know how complicated and how steep the emergency preparedness learning curve is. And you guys, right, Kevin, I mean, you guys just, you did an amazing job. And I think it's important to acknowledge that, and thank them. Kevin, you're the last man standing from that group, for which we're grateful. But
Yeah.
Well, thank you for the acknowledgement. Yeah, it was interesting early on, I think the thing for me that I learned is the learning curve, while steep, I was impressed by how well we were able to manage it. The reason why we're here rescinding most of these orders because we were ahead of the state. We were out in front of all the orders that they were putting through.
Yep.
So I thought was pretty impressive. And just to add on to your thanks, as well too, the nurses that we've had these last 15 months, but by far exceed our thanks for sure. So. I wanted to make sure I added that in as well.
Yes,
I think, Gene, what was the record for the number of was it 3 straight weeks? Number of meetings? We had something like 70, I don't know, it was like 67 meetings before the summer.
Yeah, it was around 70 meetings. But like I say, before really over a period of months. Crazy.
Yeah.
Right. Yeah. And I thank you, Kevin. I was not in any way minimizing the effort of staff. I wholeheartedly agree with you. The nurses have been amazing. We'll have to have another meeting and acknowledge all of the efforts. I really would like to acknowledge all of the work that people put in. And as Jean You
Yeah.
were there for every one of the meetings, I think. And you absolutely, deserve the recognition and acknowledgement of the effort and the dedication and commitment that you showed to the community. So thank you all. I'm really proud to have gotten to step in after you and continue your work.
You sort of
Was
made our
particularly-
jobs easier.
Well, it's particularly remarkable, and actually going back to Paula's comments at the Memorial Day service, that those early months of the pandemic, that was like the fugue of war. There was information coming, there weren't any standards, and I think the Board of Health acted so much more nimbly and timely than the larger entities like the Commonwealth or even obviously the federal government. And so, kudos for doing that and getting through that fog.
Yeah, we were actually blessed to have the people that we had early on, especially because their expertise, we just couldn't have done what we did without their expertise.
Absolutely.
Could I just chime in for 1 second? I know I don't have the skills to be a man of few words, but this is a historic perspective event as far as I'm concerned. And the folks that put those for the reasons that we've mentioned right now, the folks who put all those guidelines in place took a lot of courage. And I don't know how we recognize them. Right now, we're undoing what they did, and they sweated and toiled over those decisions, sometimes every day, I'm sure. So, whatever we do tonight, I think it ought to have some kind of a footnote that, we really deeply appreciate it, and I hope we can draw inspiration rather from what they did during this time, in case we have to, use that kind of courage later. I don't know if that captures it, but I mean, I have a deep
I think it
respect
does.
for those folks.
Absolutely. Well said.
All right.
And that's all I got, by the way. Did I put people to sleep?
No, we're not asleep. We're pondering.
Pondering for sure.
Oh, one more thing though, as long as there's this pregnant pause. Jean Dilios, and I'm going to be doing a lot of things with her name in the weeks ahead, but she was there for us. She was like our administrative person all those months. I mean, I got here in November and she was already here, but to see the amount of work that she compiled, she was still getting minutes approved and then posted. Where did she get the time? I have no clue. So this lady works behind the scenes. She's an unsung hero, and I could carry on and on about that. And sometime I hope to have the opportunity to do it.
Yep.
Tonight might not be the
Definitely
best
second
time.
that.
I agree with that.
Thanks.
I think Rick froze up on us, and that's why he must be calling back in here.
He froze and had to leave. Here he is.
There he comes.
Dangerous thing to do, Rick. Leave me with an open mic.
He did fine. You're mute, Rick. You're muted. Rick, you're still on mute.
Lower left-hand corner. There you go.
Thank you. I think we should have on the website not only announcing that we've taken this vote, but also including some explanation about the reporting numbers that we talked about earlier, and also acknowledging the work of the board, particularly in those early months, the first 6 months of the pandemic, and the comments that were made just now around the dedication, hard work, foresight, and technical knowledge. So I think that would probably be something we would want to get on that page, and potentially maybe even on the full town website have a link that goes to that. But because I think we need to get the message out.
Agree. And there were so many other people in the community involved, you know, I mean, the command staff dedication and there's a lot. So I hope that this is our tip of the iceberg chance to reflect and say thank you. And maybe we can reflect a little bit and figure out what that statement looks like. And, you know, if there's a way to do I don't know, a more
Award.
Yeah, something. I mean, really, really, I agree.
Okay.
I just sent Peter a little message about that, wondering if we could have some sort of public acknowledgement, like giving a framed certificate of appreciation to the former members of the board and our nurses.
Yeah.
Yes.
Well, I'm only half kidding, but Kevin, when's your next event we can crash? Kevin, you got another event. They will crash and give awards for public health. When's that going to be? Veterans Day. I don't know if that'll fly.
Yep.
Just kidding, folks. Just kidding.
Yeah.
Kerry gets it.
Yeah.
So I
We'll
would
figure
like-
something out. I think we should do that, Paula. We'll figure
Yes.
something out.
Yeah, we should figure something out to make it public. So I'd like to make a motion that we approve the resolution that was previously put up there by Jackie. And I don't think I need to read it. Do I need to read it?
I would read this one.
Okay.
I know it's kind of long-winded, but I'd just to be, this is probably the one you want to read.
Yeah, right.
So it's on there for recording purposes as well.
So the governor of the Commonwealth of Massachusetts declared a state of emergency relating to the COVID-19 pandemic on March 10th, 2020. Beginning on March 11th, 2020, the Reading Board of Health took action on a number of orders pertaining to building, business, facility, and recreational restrictions and closures, as well as a number of other orders pertaining to restrictions on door-to-door canvassing, health reporting requirements, and additional permit compliance requirements, with the intent of protecting the public from the COVID-19 pandemic. The state of emergency in the town of Reading, which was declared on April 1st, 2020, is coterminous with the state of emergency in the Commonwealth, which will now end June 15th, 2021. As such, effective today, June 3rd, 2021, the Board of Health hereby rescinds all of its COVID-19 related orders dating back to March 11th, 2020. The board fully endorses and, to the extent allowable by law, will enforce current and future COVID-related guidelines, advisories, and mandates as promulgated by the Commonwealth. In no way does this action impact the authority of the Board of Health from issuing additional COVID-related orders deemed necessary by the board for the town of Reading at any time in the future. So I would make that motion.
I would be happy to second that.
I have a second.
You should ask for comments, Mr. Chair, just in
Okay.
case on something like that.
Okay,
After it gets seconded, the next step would be to ask
you're right.
any further
Right.
comments.
Actually, Jackie, can you unshare? Okay. Any comments, questions, or concerns? Okay, I'm going to take a vote. Carrie,
Aye.
Paula,
By all means.
Rick, aye. The motion is passed. And so, Kevin, that obviously applies to the senior center as well.
Yep.
And I think that is our work for tonight, unless there are any other last minute items or anything we need to address before our regular meeting in 2 weeks. We're good?
Good.
Okay, motion to adjourn. Do I have a second? Carrie, second. Let's take a vote. Paula,
Yes.
Carrie,
Yes.
Rick, yes. All right, thank you all.
Good
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 night,
luck, Kevin.
everybody.
Thanks a lot,
Thank you
everybody.
all.
Have a good
Great
night.
work.
Good night. Thank you.
See you later.